dental patients who are members of racial and ethnic minorities have long faced disparities in accessing and receiving oral health care, and the pandemic has only made these inequities worse. Now, the Hispanic Dental Association, the National Dental Association, and the Society of American Indian Dentists have teamed up to form the Diverse Dental Society, an interprofessional collaboration that aims to address these issues. Today, we're speaking with Dr. Anna Munne, president of the Diverse Dental Society, to learn more about the organization and its goals. Dr. Munne, thank you for joining us today.
Thank you so much. Thank you for having me.
Great. Well, let's just begin with the beginning of the organization. Can you tell us how it all came together?
Absolutely. Well, there's three organizations, which is the Hispanic Dental Association, the National Dental Association, and the Society of American Indian Dentists, that are grouping minority dentists and have been already historically working together in many different areas. We have done outreach events together, leadership training, and even advocacy. And there was a conference in 2012 in Boca Raton, Florida, that was very successful, of the three organizations. And after that event, there was a desire for doing another one. And, almost 10 years, so 8 years forward, we started working and talking about, doing another conference together. And that was the main idea. That's how, everything sort of kind of restarted. And we were planning on doing a conference for this year, for 2021 in June. But when we started working together, because all three organizations have, our mission statements, our goals are very similar, and also our challenges are very similar. And we also are targeting groups that, they all have challenges as well. So we thought that our impact would be a lot bigger if we would group into one bigger organization, like a bigger umbrella that would undertake all the three organizations and support them, but also try to be a bigger voice as well. So that's how everything got started.
Can you provide some more specifics or details about what the goals of the organization are? What are you trying to achieve?
Yes, very good question. Our goal, one of our goals, is to support our, member organizations. But the goal of the Diverse Dental Society is to help the oral and healthcare needs of diverse communities. And we're going to do this through equity, advocacy, leadership, and outreach.
Okay, and what steps has the DDS taken so far to work towards achieving those goals?
Well, number one, our organization is very young, not quite 1 year old. We got established in April of last year, so in the middle of the pandemic. And the main scope of this year has gone into organizing this event for June, which was going to be, and I say in past tense, was going to be, because unfortunately we had to cancel our conference, but it was going to be in Atlanta, in the Hyatt Atlanta, in June of this year. The conference will still stand, but it's going to be a virtual event. But due to travel bans for universities and vendors, we had to postpone it for another year. So we've been working on this, and especially on the setup of the organization, setting up the, the different things when you open a 501c3 is quite, complex, and making sure that we are set up correctly. And we have also done a series of different committees. And one of the committees is an outreach committee. We had a schedule for last year for September, an event in Oakland, in the university in Oakland. And we unfortunately had to cancel, but everything that we have done so far, we have to cancel because of the pandemic. So it has been such a big impact on all our activities. So at this point, we have been working in different programs. We have been working with a campaign giving oral healthcare kit in collaboration with Colgate to different diverse groups and other, grassroots organizations that are helping us on distribute oral healthcare kits for people that have not much means. We're worked also on the virtual event, and we've been trying also to work with different universities and organizations. We do have also faculty members that are part of our board. So we are trying to also reinforce in the mission of all the three organizations, HDA, NDA, and SET, that they have in regards to, working on the pipeline and making sure that we get, a lot of more numbers of diverse students into schools, not only dental schools, but, all the dental careers. We need to make sure that we have all the dental team covered.
Okay, and you referred earlier to your partnerships with organizations like Colgate in getting oral health care kits out to communities that simply lack many of the basics of oral health, dental hygiene, and so on. Can you provide a little bit more detail about some of the oral health challenges that these communities face right now? Is it a matter of insurance? Is it a matter of not having enough providers in the area? Why are these communities so challenged?
Well, you're bringing a very good point, Richard, because there's a lot of challenges, and as you mentioned, some of them, it's a multifactorial problem. So number one is the fact of education. So we need to make sure that education reaches all those communities, and we need to educate, starting at the school level, and sometimes just making available for one kid to go to school and have a higher level of education. It elevates the education of the whole family, because that person is going to help the rest of the family have a better standing of living, and maybe a sibling or another cousin will be following those steps as well. So sometimes having like that first person that's going to even hygiene school or assisting school or dental school, that would be great. So education is a big factor, and also education in the basic things on nutrition, oral hygiene, basic things that affect all the health, not only oral health but also overall health. And other challenges like socioeconomic status, access, because of not having transportation or being able to have somebody that understands them, somebody that has some cultural affinity, that speak their language. So there's a lot of issues, and the problem is very complex. So it's going to take a while to get to it, but we have to work on it. If we don't work on it, we're not going to get results.
Okay, so in addition to just educating children and families about the basics of oral health and oral hygiene, there also are efforts in creating a pipeline so that way many of these students could go on to careers in dentistry as dentists themselves, as dental hygienists, or other auxiliaries. Can you tell us a little bit about your efforts in enhancing that pipeline from student to professional?
Absolutely. Right now, so far, we've been basically supporting the efforts that HDA, NDA, and SET have done, but we worked very close, with different organizations, but definitely Colgate's been a big supporter that also has granted, some scholarships and making available, for some students to have more means. But this is one of the areas that we want to work strongly. So as we are getting more set up into our organization, and we have, everything a little bit more coordinated, we're going to be working with the schools, but not only with the schools, also helping pre dental students. Sometimes those students, they don't have good DAT scores because they don't have help. Maybe the family situation is difficult. Sometimes they might need to work part-time or something. So we want to make sure that we make available for those students to have help to get good DATs scores. We also have seen that when we have students that have help, that actually they get the same DAT scores as other students. So when the help is there, we know that they're going to have enough scores to be able to get into dental school or any other school, and also help understand, the deans of the schools, that we need to get more diverse students into those classes.
Okay, and once students do get those scores up and are able to get into dental school, are there scholarship programs available so that way they could fund that education?
Yes, there's some scholarships available. Now, we do not offer scholarships that fund for the whole school. So
Mhm.
those are, scholarships that maybe can fund part of their tuition, or maybe part of, anything. The money goes directly to the school, and the school is in charge of making sure that the student actually uses those funds only for education. But our funding depends only on how much money we're able to raise, to fundraise. So fundraising is also a very important part of what we're doing right now, so we can actually afford those programs and offer those programs.
Mhm. And nationwide, there's so many dental healthcare professional shortage areas, whether they're in rural areas or even in cities. So what can your group do to help make that transfer from a successful dental student and graduate to working professional in these shortage areas?
Well, we believe that by having more diverse dental professionals, that those professionals are going to set up in the areas that they come from.
Mhm.
So those areas that they have, let's say, not a lot of dentists that are set up on those areas because maybe there's a low socioeconomic status on that part of town. But if we actually help the kids that live on that part of town get schooled and educated and maybe graduate, they'll probably open a practice right there. So, and there's the neighborhood, and a lot of dentists actually open in their neighborhood, so we need to graduate more students that belong to those areas, and those are going to be the ones that they're going to help on bring access to those shortages.
Okay, and earlier you referenced your partnership with Colgate. Can you tell us a little bit more about that partnership or maybe others that you have to work together towards these
Yes,
goals?
and thank you so much for asking this question, because I totally want to give Colgate the credit that they deserve. Colgate has always been a big part of HDA, NDA, and SET. Yeah, they have been very instrumental on the growth and even from the inception of those organizations. They've been partners with us from the get-go, pretty much. And the same thing has happened with DDS. Colgate has been behind us and helped us, get off the ground, and has actually helped us right now with all the dental supplies, which there's been like a lot of dental supplies, $30,000 in dental supplies that they've been distributed all around the country. Uh, Thank you to Colgate. But also we have done another campaign, which is a campaign for a video production. We have done a video contest, and this video contest has been just to get ideas. The theme was the safety of oral health during the pandemic. And with this contest, which the contest has already been finalized, and we had 3 students that were winners, one from each organization. But now the board and our task force dedicated to this specific video is going to do a professional video that's going to be distributed later on through the organizations, to the member of the organizations, and to everybody really that can be made of use. So the video will have exactly the same scope, which is educate patients on the need of dental health care and how safe it is to even get your dental health care during the pandemic. And we hope that this is going to remove some of the fear that some patients have to go to the dentist with, you know, the virus and everything around.
Okay, and these videos, they're going to be available online so that way dental practices can incorporate them into their own promotional materials.
Exactly. It'll be available to the membership, and they can use it in their Facebook page, in their websites. They can distribute it to their patients. And we hope to be able to distribute this video as large as possible so we can have as many people as possible see it and feel confident about going to the dentist.
Okay, and just looking ahead, what are some of your next goals for the DDS? What's next on the horizon that you're hoping to achieve?
Well, we have a big agenda and a lot to do. So right now, the next thing, the most immediate thing, is being the turn from the face-to-face meeting into the virtual meeting. So right now we are very much focused into transferring everything to virtual. Our meeting that we were going to have, and we're going to try to incorporate that also into the virtual, was going to have not only dental dental topics, but also social topics to discuss some of the issues and you know, addressing social justice and things like that that are common in diverse communities. After that, we are really waiting to be able to do things like face-to-face until the pandemic and all the bans stop, because the outreach is really very minimal. We can do some with the videos, and that's the reason why we also wanted to do this video, because we wanted to be able to distribute it and use it as another tool of education without being able to have the face-to-face, because all the outreach events, they're traditionally been face-to-face, you know, either providing screenings or educating patients. But we're going to try to work very heavily on the pipeline, see how we can get some of those students to get better scores, get into school, and get more people graduated. Also on advocacy, trying to educate legislators on the needs of diverse communities and see if maybe we can have better help, because even right now with what we've seen during the pandemic and COVID-19, with a very, very large number of infected patients on diverse communities, especially Latino and African American communities. And we've seen the same thing now with vaccinations. Even with the large numbers of infection, we see that, for instance, Latinos are having a very, very low index of vaccination. So we definitely want to see what can be done on that area, and maybe work and see if we can improve some of those numbers.
Okay, and speaking of vaccinations, throughout the country right now, some states are allowing dentists to participate in the vaccination rollout. Some states aren't yet. Would you be in favor of your organization advocating for your members to be part of the vaccination program?
Absolutely. We want to make it available to everybody that needs it, and everybody that, of course, is a voluntary thing. So everybody that wants to have it, that they would have it available. So there's obviously a lot to do, you know, and another thing that we want to do is work on trying to educate them on nutrition and things that can help their health improve, because there's a very high index of high blood pressure and diabetes in all those communities. And those are some of the trigger factors that made those patients more prone to COVID in the first place. So making sure that we touch everything across the board from, nutrition and oral health. That's very important also for patients to avoid infection with the virus, and then make available the vaccine along with all those things as well.
Okay, and just one last thing then. How can dental professionals and other allies get involved with the DDS and its mission and its goals?
Well, DDS by itself does not have direct members. So our members are the organizations. So by becoming members of HDA, NDA, or SET, they will be members of DDS automatically. So I would say that, either become a member and show support to the mission, also with a donation. Our organizations can reach as much as what our funding can afford. So making a donation will also help for us to be able to do more programs, to have more students, and to have more people with dental needs. So all those things will always go a long way, even if it's a little bit, helps a lot. And they can donate directly to the Diverse Dental Society through the website at diversedentalsociety.org. And if there's also information over there on how to reach to the officers and to the board. Our emails are available there as well. And of course, anybody can contact me directly, and we'll always help them as well.
Great. Well, thank you for sharing that with us. And we look forward to learning more about the organization and its progress and its goals in the future. Thank you again so much.
Thank you, Richard, for this opportunity and allowing us to be present in your program. Thank you.
Great. Thanks again.